Assalamu alaikum, hello and welcome to the Health Show here only on the Islam channel with me, Alistair Greener. Every week we're joined by a health expert within their specialised field and discuss the prevention of health issues or concerns that we or our loved ones may face. Looking at how you can change your health and lifestyle for the better, the Health Show offers an alternative viewpoint from our health experts who attend the show to help guide you in the right direction. If you'd like any further information on our programmes or any of the topics that we discuss, then please do get in touch. healthshow@islamchannel.tv. Now, today we'll be looking at strokes. Public Health England have relaunched the national F.A.S.T stroke campaign, working closely with the Stroke Association. The campaign aims to raise awareness of the symptoms of a stroke and to encourage people who recognise any single one of the symptoms to call 999 immediately. The campaign includes TV, radio, social media and outdoor advertising and is supported by PR. The campaign has a strong BME component targeting South Asian, African and Caribbean communities where the risk of a stroke is actually more prevalent. To discuss more about the relaunch, it's great to welcome Dr. Sriman Andol, a stroke specialist and spokesperson for the Public Health England National F.A.S.T campaign. Dr. Andol, thanks so much for coming into the show.
Assalamu alaikum, and thank you so much for inviting me.
We've got lots to talk about, but and actually before we say anything else, let's hear a little bit more about Dr. Andol, who is a divisional director and clinical lead in stroke neurosciences, as well as a specialist in medicine at Barking, Havering and Redbridge University Hospitals, an NHS trust. Dr. Andol has also been the lead of the hyper-acute stroke unit at Queen's Hospital, which has been rated in the top 25% in England as a result of following the Sentinel Stroke National Audit Programme. He is also editor for the BHURT Stroke Bulletin. Before we talk more with Dr. Andol, let's take a look at a short clip about the Stroke F.A.S.T campaign.
When a stroke strikes, the damage spreads like a fire in the brain. If you spot any single one of these signs, think and act fast. F. Face. Has their face fallen on one side? Can they smile? A. Arms. Can they raise their arms and keep them there? S. Speech. Is their speech slurred? T. Time. It's time to call 999 if you see any one of these signs.
The day I had stroke, I was watching television with my family. I never thought that something like this will happen to me. If my wife would not have dragged me straight to the hospital, I think the whole picture of my life would have changed. Immediate action is the answer to the whole thing. If I didn't have the treatment in time, I think it would have been a disaster. I would have missed all this happiness, what I am enjoying now.
If you do know of someone who is experiencing signs and symptoms of stroke, call 999 without any delay. It may save their life.
The faster you act, the better their chances. Act fast. Make the call. Dial 999.
I mean, that was really interesting and very informative, and obviously it's still a message that you've got to get across to everybody. I'd like to start at the very beginning, if I may, about what a stroke actually is, how it happens, who it's likely to happen to, and also we talked about the BME community and why they're particularly vulnerable to it. So let's start with the beginning. What actually is a stroke?
Stroke, in as simple terms as it is a damage to the brain. And so if you want to expand on that, if it is damage to the brain because of lack of blood supply or interruption of the blood flow to the brain, and that can happen by two mechanisms. One is either the clot or is it a burst of blood vessels, but the end result is that there is a damage to the brain.
And obviously, as we're going to find out, time is absolutely crucial because obviously as soon as you stop blood to the brain, that's when it becomes really, really vital that attention is sought.
Correct.
What actually causes these various blockages or problems?
Right. I mean, so stroke is an end result of several other mechanisms in the body and several other wrong mechanisms in the body. And we talked about, you first introduced yourself and said that this is a common condition. It's very important to realize that it is not as rare as you think it is. It's quite a common condition. 1 in 5 women over the age of 75 has a stroke, and 1 in 6 men over the age of the same age will have a stroke. And especially it is very common. It's twice as more prevalent in South Asian, Black and ethnic communities than the native population. So this is quite an important kind of condition in them. And because it damages the brain, and brain is a critical organ, and this can be, the results of this could be quite fatal in the sense that the patients may not survive this attack, and the end result is they may even die. And that is the reason why it is quite important that you actually recognize, act and respond to this condition.
How does, you talked about lots of different things that can lead to this condition. Just maybe discuss a few, and maybe let's talk a little bit about anything that we can do to hopefully reduce our chances of it happening to us.
All right. So keep it as broad as we can. And we said that it is very common in Black and ethnic minorities. And I'm kind of stressing on the fact is that certain health conditions or certain health conditions, chronic health conditions, are more prevalent in these populations. We're talking about diabetes, hypertension, high cholesterol, obesity, and bad cholesterol, high cholesterol itself. And again, with excess alcohol and smoking in these populations make them more prevalent to having a stroke.
So are we saying that basically in the BME communities, maybe the diet, maybe what they're eating, leading to diabetes, high cholesterol, and so on, that it's to do with almost lifestyle in a sense?
It is absolutely. And when you talked about lifestyle, we touched on the cholesterol, but lack of exercise will add to the fact that why cholesterol becomes an important factor in, again, getting or you having this condition. So it is about this prevalence is very high in these communities, and that thereby it impacts on the way the stroke happens in this population. So it's twice as common than the native population.
Now, exercise, obviously, that's an easy one to solve. Just get out there, start walking, do more. And I know the NHS have got a lot of campaigns, especially surrounding sport relief, about walking X amount of steps a day and so on. And there's lots of great tips people can do with that. Diet is a little bit more difficult because, again, it's a habit, and sometimes maybe not such good habits that we all get into. What is it about the food or the way that maybe these communities are eating and preparing their food that makes them particularly vulnerable?
Yeah, there are two different things about the food. The first is about the type of food you eat. When I talk about the type of food, we all recognize that certain types of food would have a high cholesterol content in it. We all know that fried food is not good for us, and we all know that certain types of meat, which is especially the red meat, is not good for you. And these contain high amount of cholesterol, but not just the normal cholesterol, high amounts of bad cholesterol. This on top of the fact that the ability to kind of process this cholesterol in these populations for genetic reasons or different reasons is not as good as it could be. So triglycerides and bad cholesterol, these kind of things go very high.
So it's almost like a double whammy in a sense. Again, just before we go into the other things, you said about the foods that, like certain red meats and things. Let's just maybe just have a quick little list, if you may, of the things that people, all of us should be avoiding, but particularly people in the BME communities, because A, they may be consuming a little bit more, and B, of course, as you said, there's this genetic element which puts them more at risk.
Well, okay, we'll start off from the fact that what they use. First of all, fried foods. We talk about, when I say fried food, it could be anything from samosas and everything, those kind of stuff, to fried bread. And about the type of oil you use in the food, that could be saturated with lots of saturated oils are not very good at it. And the third bit is about the use of clarified butter in their cooking ingredients. Is again a very high risk.
So things like ghee, for example.
Ghee and the butter and everything. These are very high in saturated fats, and that can cause significant damage. And then we talked about the red meat. We talked about all those things. The thing is about eating is that I think people are aware of the fact that certain food is not good for them. I think it's about trying to discipline themselves in trying to eat the right food for them takes a bit more out of them. I think.
How much of a difference would it make if people just say, let's say they cut it down by 50%, because as you said, it's getting in the right habits, but that's pretty difficult if you're used to a certain way of eating, you know, as a family, this is the way you eat. How significant is, let's say, if you manage to cut the amount of these bad foods, as it were, in half? How much of a benefit would that be? Would that be enough?
Right. Well, I think there's no amount of, I'd re-emphasize, no amount of stress would kind of, I can't stress enough to say that stroke is a preventable disease. For majority of the conditions, if you actually control the risk factors better, when I talk about risk factors, I talk about either diabetes, high cholesterol, and again, the type of food you eat. If you can actually control this, this becomes a completely preventable condition. So when you actually start adding modified diet into it and you actually control your diet better, the chances of this actually causing, impacting on the lifestyle you have and these risk factors you have, how it controls the blood pressure and, you know, the diabetes, it will significantly go down, and thereby reducing the risk of stroke to almost significantly less. It's very difficult to quantify it, but the studies have shown that up to 20 to 30% risk is just gone by diet alone.
Wow, and that's a significant amount. And actually, one of the things which is quite interesting, which I've only found out fairly recently, we normally associate, you know, diabetes and high cholesterol and high blood pressure and things with people who maybe are carrying too much weight. But actually, you can have high cholesterol even if you're slim, can't you?
Absolutely. And the cholesterol is synthesized or processed and manufactured by your own body enzymes, and that's secreted in the liver. So it is not necessarily just because you eat good food, it just kind of manages the cholesterol, but it definitely helps though. So I don't want to give a message where we're saying that, oh, well, doesn't matter what you eat, your cholesterol is going to be high anyway. I don't think that is quite right. I think diet will help. It will help the body process the cholesterol much better if you eat good diet. And again, depending on if recognition of that condition, if you do have high cholesterol, and there are certain tablets that can help you to reduce the cholesterol level as well. So all mixture of everything will help you to reduce the risk of stroke.
And finally, just before we get on to the actual campaign, where's a good source of information about what you should be eating, what type of exercise you should be doing, all of the preventable things that you were talking about that we can do to increase our chances of not suffering from a stroke?
Well, Stroke Association website is a fantastic source of where you actually know about what exactly is good for eating, but actually Public Health England websites are very good again. They talk about what type of diet is good and what are the specific diets that you should be avoiding. And you talked about the list at the start. So that would be a good source of things where to actually say what are and the good thing about these websites, it not only tells you what the diet, what is a type of food you should avoid, but also it will give you suitable alternatives. So it is a kind of a good website to go through with it.
And especially if you're in a community where there's lots of BME people, again, your doctors and local health specialists, again, will be particularly familiar with maybe your lifestyle and what you're eating, and therefore be able to help and give specific alternatives to you, you know, given what you might be eating.
Correct, absolutely. I think it is, it's quite important that you, again, we did say that it is not just about knowing it, it is also about trying to practice it.
Yeah,
yes,
absolutely.
Yes, that's a difficult one, yes.
Reading the booklet isn't enough, you've got to do more.
Yeah.
Talking about the booklet, and you mentioned there the Stroke Association, this whole FAST campaign, we are now talking about, you know, the moment that actually the worst happens. We've talked a lot about how to prevent it, but now let's just say it does happen and somebody is suffering a stroke. This campaign, you know, we've seen it, as we said before, it's now being relaunched. Give us an overview of what the campaign is about and why we have to keep on repeating this campaign to make sure that people understand.
Yeah. Over the course of several years, I mean, it's great that Public Health England has got into the act of actually trying to raise the awareness of stroke among the general population. And it was the campaign got off to a great start, and there's been lots of success out of it. The main reason for getting this campaign on the board is that health education is the only way to get the public and the people who are living with the people and relatives, friends and all, to recognize the stroke very early and bring them into hospital. So Act Fast is essentially a kind of, is basically a translation of what needs to be done. F stands, ACT is ACT, and again, F stands for face. F is a face, a droop of a face on one side. A is the arms, unable to hold the arms at one straight line, and you drop the arms. S stands for speech, speech when it becomes garbled, and when T is the time, time to act or time to call 999. If any one of these signs is present, it's important that people call up the ambulance, get into the hospital, and seek medical attention straight away. And it's a key bit is that is the reason why, that is one simple thing that they can do. Recognize the stroke early, seek medical attention.
And we'll keep on repeating FAST as we go through the programme to make sure people really understand the importance of all the different elements. What do you think is the thing that stops people, that prevents people from maybe picking up that phone? What are these sort of symptoms maybe where it's a little bit borderline, where maybe they just don't quite get it, that it is actually a stroke that's happening? Or are there other reasons why people don't actually pick up the phone?
Well, it's a billion-dollar question you asked, because one of the key bits is about the patients I see within the hospital is that most of the patients are not able, we are not able to treat them for stroke, is because by the time they come into hospital, they have actually come too late, as it was, where you could have actually, they missed out on emergency treatments that can be given to help them reduce the disability, and sometimes you can even reverse the condition what they've had. So they've missed it. So actually the reason is they don't come and present to the hospital early enough. The point, there could be several reasons. First of all, none of these symptoms, what about I said about FAST, is when it starts, when it comes on to you, none of them appears very serious. So it is not like a crushing chest pain, like when you have a heart attack, when there's a lot of distress is associated with it. So these symptoms with stroke are very, very simple in that they do not cause a lot of distress. So it may well be, we do not know that, but it may well be that they take it easy because they think that it is kind of one of those things. Number two, it is about awareness and education. I think that we just generally know that lots of people fail to recognize the symptoms as an early sign of stroke. I think that is a key bit. Even if we focus just on education, it's about the way they know that these are the signs of stroke, and it's quite important that you pick it up and they bring them in. And the third bit is sometimes these symptoms come and go. When it comes and goes, that is what we call as a small mini stroke or a TIA. These things, you can actually still need to go and seek urgent medical attention, because quarter of the strokes happen, they're present with warning signs. So even if you can identify the warning symptoms early enough and seek the medical attention with the right treatment, you can prevent a bigger thing happening. So there are several reasons, and the health, again, Public Health England is running a campaign, or rather just finished a survey on trying to understand the reasons, cultural or otherwise, or education or otherwise, trying to find out why people have not been kind of proactive and what are the reasons behind why this is not kind of as good. The success that you see generally across with the Act Fast campaign, why is it not so stronger in certain communities?
I was going to ask you that, actually. You know, is there anything that we can think of culturally why the BME community are not reacting to it? Is it because we're just not getting the information to them? Is it because there's sometimes this thing of, you know, well, we'll sort this out ourselves? I mean, what do we think is particularly relevant to that community?
I think it is probably a mixture of all what you just said. First of all, is about education itself, and we know that certain communities are not as aware of, or not culturally as aware of they're not keen on their health as much as they should be. That could be one thing. The third thing is about the way they are aware of how to respond to this is another thing. And the third thing, culturally, again, they're very reluctant to respond and call up the ambulances and things like that when it is needed. So I think it's a mixture of several things that might have caused them to not to use it. But again, awareness is getting better. People are now starting to realize the importance of it, and people are importance of recognition of early symptoms of stroke. And Act Fast campaign has done a terribly, fantastically brilliant work on the fact that the Public Health England has now, it's really, really picking up. But it's not to the level where we would want to.
And that's the thing, isn't it? We
Yes.
always want more people to be involved with it. We're going to be taking a break fairly shortly, but before we do, I want to keep on reiterating the FAST campaign and what FAST actually stands for. So go through that one more time for us.
So it's very simple. Act fast. Fast. F for face. When there's a droop of face on one side. A is the arms. When you outstretch hands or arms, when you can't actually keep them at the same level. S stands for speech. When the speech becomes garble. T is the time to call 999. And it is not all of these symptoms. If any one of these symptoms is present, call 999.
Perfect. And we're going to repeat that again before the end of the show. But at the moment, we're going to take a quick little break. Just before we do that, we must stress that should you suffer from any medical problems or have any health concerns, it's always highly recommended that you contact your doctor or GP, as the health show only gives you an alternative viewpoint to the health concern being discussed. Now, it is time for a short break now, but don't go away, because straight after the break, we're going to be talking to somebody who did act fast. And you're going to hear all about his story in just a moment. Hello, welcome back to The Health Show, where our topic today is strokes, and we're looking at the Act Fast campaign. Now, a stroke is a medical emergency. In the Act Fast campaign, the public are being urged to take symptoms seriously. One of the main objectives of the campaign is to get people who witness somebody who is showing stroke symptoms to overcome any initial reluctance they may have and make the call and dial 999. Joining us for this part of the programme is Charles Bozer. He helps the stroke campaign by talking about the subject from a perspective of someone who's actually suffered from a stroke. Now, before we introduce him, let's hear his story.
Black people are twice as likely to have a stroke compared to white people, and at a younger age.
The day I had my stroke, I had things like a shock, like electric shock in my brain. I look at the mirror and my face was drawn with the little strength I had, I dialed 999. And when they were asking me my address, I couldn't speak, I couldn't talk. My speech was going, I had to shout. At the hospital, they put me on the scan and told me that I have suffered a stroke. I would say I am very, very lucky. I contacted the ambulance on time, and that really changed my life.
When a stroke strikes, the damage spreads like a fire in the brain. If you spot any single one of these signs, think and act fast. F. Face. Has their face fallen on one side? Can they smile? A. Arms. Can they raise both arms and keep them there? S. Speech. Is their speech slurred? T. Time. It's time to call 999 if you see any one of these signs. The faster you act, the better their chances. Act fast, make the call, dial 999. Search Act Fast.
That was fascinating, and it's a great story, Charles, and the fact that you're here today is testament to the fact that you acted fast. For you, knowing that you had to act fast, that probably saved your life, didn't it?
It did. In fact, it did save my life because I acted fast. I have no idea about fast. I don't know anything about fast, but I acted it, and it did save my life.
So you were just one of those fortunate people who, in a sense, just knew instinctively, I need to go and get help.
Immediately it happened to me, I called 999 when I realized that I was in serious trouble before it gets worse.
And then they took you to the hospital?
Yes.
Where you were treated?
Yes.
And what actually happened in hospital?
Were
you aware of much going on? Or?
Yes, I was a bit aware of what was going on when I was in the ambulance and came to King's College Hospital, and they put me into a scan and told me that I had blood all over my brain. In fact, that my brain was like a scrambled egg.
Wow.
that they were surprised that I didn't die immediately, that they thought that I'm going. But I asked them what to do until they rolled me to the bed, that I saw stroke unit. I asked them, did I have a stroke? And they said, yes, you are very lucky to be alive. Then after 6 hours later, 7, my whole body shut down. But the only place I could move was my neck and this, and talked a little. My speech was also gone, but I got it back because I fought hard to get it.
Now, interestingly, hearing that story, Dr. Ndol, is that again, timing is absolutely everything here. You know, one can just imagine if you've got blood in your brain, it's turning to scrambled egg, that if you just leave it longer and longer and longer, how much you can deteriorate through that. Talk us through, from a medical point of view, the process from the immediate moment that the paramedics will reach someone like Charles. What will they be doing? And then talk us through that process to the hospital.
Right, and so right at the start of the interview, we talked about there are 2 types of stroke. One is because of damage to the circulation because of a clot, and the second type of stroke is because of rupture of blood vessel. 80 to 90% of strokes are because of a obstruction of blood flow because of the clot. And I do not know Charles was same thing as that, but it could have well been a rupture of a blood vessel. But 80 to 90% of strokes, when the ambulance calls you in and then they rush it to the nearest hyperacute stroke unit, they go on to do the scan, and this is to find out the level of damage the brain has had and to look at if there is a clot in the brain. And if there is a clot in the brain, and what you do is there are several types of treatments that are available now, depending on the right criteria. You know, the patient needs to fit in that criteria and the timing of it. We do give you drugs that can dissolve the clot straight away, more or less, thereby limiting the damage to the brain. Or sometimes, like I said to you, it can reverse already, or it is you can go back to where you were before. And the second type of treatment that is available, more and more available these days, is actually, even if there is the drug that does not dissolve the clot, you can actually, through the groin, you can pass a catheter, go up to the clot, pick up those things and retrieve the clot outside the circulation. So, and thereby restore the blood flow back to normal. So it's quite complex, it's quite unique in that, this treatment for stroke, hyperacute stroke, which is what we call, has progressed so much. Radical treatment changes have happened in the recent past. Of course, there are other drugs that we use, the aspirin and other statins and everything else, that will help you to restore that blood and prevent for another stroke happening as well.
And we'll talk about the aftercare and all of that, and certainly hear Charles's story from that in a moment. What was interesting was that Charles said that, you know, he went for his scan and then actually his body started, it continued to deteriorate despite the fact he was still at hospital. Is that again a normal process?
Well, it depends on, it's very difficult. I wouldn't know what exactly happened at that time when Charles was there in the hospital and what type of stroke he had and the level of damage you had. So once the damage to the brain it's usually reversible. It's quite serious. There is no way the brain doesn't kind of get back, repair itself and start to work back again normally. It doesn't happen. Brain is kind of a critical organ. The damage is usually reversible. Every minute you stop the blood circulation, there are more than 1.9 million cells, neurons are lost in the system, and then the damage is gone. So I'm not completely sure about what Charles' stroke was like, but I guess you're right. I mean, so once you have the stroke, if you just let it just do nothing, the natural course would be a continued deterioration of physical symptoms, or the level of disability the patient has had will continue to deteriorate. I think what Charles might have seen is that it started off suddenly, and then he started to experience those symptoms as time went by. And by the time he was rushed up to the stroke unit, he was in a state where the level of disability was so bad that he did not recognize the rest of the body. It was just about his movements of the neck, which is what I hear.
So we hear about this paralysis, and typically, as you're saying, down one side of the body. Why is it only down one side, and why is it actually paralysis that's happening?
Yeah. Well, I mean, this is quite a good question, because although we try and, in our kind of education piece of work, we said about F.A.S.T campaign, and we looked at only few things, the stroke symptoms are related to which part of the brain that it gets damaged. So it could be with swallowing, talking, eating, drinking, breathing. It could be with loss of sensation on one side, loss of power on one side. So it could be absolutely anything.
So basically you're preventing the brain from communicating with different parts of the body,
yes.
essentially.
So depending on which part of the brain gets damaged, you can get that symptom. So not necessarily just the symptoms what we talked about. So loss of power on one side of the body is the commonest symptom, and that is why we focused on that. And if you can actually stick to that one side, majority of the strokes do fit in that pattern. So it is the loss of power on one side of the body is quite a significant factor, significant symptom of stroke.
Now, obviously, once you've been to the hospital, you get treated, then we normally associate with stroke victims having quite a long recovery period. Charles, tell me a little bit more about what happened to you. How long were you in the hospital, and then what happened afterwards?
I was in the hospital for 4 weeks. But the first 3 weeks, I was completely in a vegetable state. And the doctor told me eventually that they didn't want to operate on my brain to remove the blood clot, that the ruptured artery has healed itself. Although they gave me some medication, maybe that the medication worked, and the energy began to go into my brain. So I asked what happened to the damaged brain. They said that because of the left side of my body is completely paralyzed, that I may regain some mobility eventually, and that part of brain might adopt each other eventually. And if I'm lucky, I will regain some of my mobility.
And it's remarkable. We saw you walking into the studio today, and although you have a walking aid, it's remarkable from where you were. And of course, one of the things that you were saying before, and Dr. Andol, is that everybody's circumstances are going to be specific to them. But you were in hospital there for 4 weeks.
Yes.
And the first 3 weeks you weren't moving at all.
Yes.
And then did they start a process of physiotherapy to help you get your mobility back again?
Yeah, they did, because they put me on the wheelchair throughout that period. They put me from bed to wheelchair and to the gym area, and then eventually put a cast on my 2 legs to help me stand. Mm-hmm. And then from there, it goes on, and eventually I started using the Zimmer frame to start to teach me just like a baby, you know, and I was responding to everything. The most important thing is the response I put and the fight, because I was responding to every treatment, anything they told me to do, I do it.
It takes a lot of effort from the patient's perspective.
Yes.
And put this into some perspective, what time period are we talking about here? From from the 4 weeks, how much longer were you having to undergo physiotherapy and help to get your mobility back?
Every day in the hospital, it took about 2 hours in the gym, and not only me, because there are so many people there who have suffered stroke. Yeah. So, in fact, I was being motivated by the experts, telling you, first of all, you have to accept that this thing has happened. The acceptance will help you to heal. So I did accept it has happened.
And then once you were released from the hospital after 4 weeks, were you then an outpatient coming back for regular help?
Yeah, sent me somewhere where there are experts that will help you move about.
And how long was that process?
That took about 6 months.
That was another 6 months.
Another 6 months, and then take me out of wheelchair, out of the Zimmer frame, and gave me crutches. But eventually they told me that before I leave the rehab center, I might not need the crutches, that I might need this. But which happened, I didn't take the crutches. I just used the crutches for 2 days at my house, and then shove it back behind my wardrobe and then use this. But I can tell myself, because it was my determination, that I must beat this.
And it is fantastic when you hear stories like yours. They're very inspiring when you look at people who've had to work so hard to overcome, you know, a tremendous shock to the system. And Dr. Undall, hearing Charles talking there about that process, I know, as we said before, everyone is different and individual, but is that fairly typical of the sort of process that will happen to somebody if they've suffered from a stroke?
I was just going to say, it's poignant to hear how people go through and how they've made their road to recovery as it was. I think it's very typical. What he's summarizing is essentially the way post-stroke treatment is. It's moved hugely, just like the way acute stroke treatment has changed. The rehabilitation process of stroke has also significantly improved. There is a team of multidisciplinary team that actually helps you recover, to get you back to the road to the recovery. We're talking about speech and language therapists, we're talking about psychologists, we're talking about nutrition, health experts, we're talking about physiotherapists, occupational therapists, all of this team, different people, getting together, making an individualized plan for a patient depending on what their needs and
I know there's a huge amount of work, isn't there, between the Stroke Association and Public Health England, working together with research to try and really work out the best route. And actually, coming back to this FAST campaign, this story, hearing from Charles, if people just knew how much they might potentially go through, is that time significantly shorter, the recovery time, the recuperation time? Is there a direct relationship between that and FAST?
Oh, absolutely. I think you hit the nail on the head. Absolutely. So the sooner you go into the hospital, sooner you get the treatment, the damage to the brain is limited by that. Once you start having that, also the level of disability you may have from stroke is also less. Thereby, the rehabilitation or the time taken to recover from the stroke is also less. So there is absolutely a direct link between coming to hospital early and also having to actually have less of rehabilitation. So it's a double effect. So not only you come into the hospital, limit the damage to the brain because of what stroke you had, but also the recovery time you may take to actually get back to where you should be is also less. So you'll save it double, yes.
And Charles, you now work very closely with the FAST campaign, with the Stroke Association. What made you feel so strongly about getting involved?
Because the FAST campaign, the paramedics saved my life. When I called them, they were there within 5 minutes. Without them, I wouldn't be alive. So I'm very, very happy to help in any way. So if others can look at the way I fought back and survived, if I can help, I will be glad to do so, because it's not easy. If I tell you the story how it started, I don't think I would have been alive without 999, because it happened so fast.
And your story is incredibly powerful, and to hear your road to recovery and to see you looking so well today. Let's put this into real perspective here, Dr. Undall. How many people don't survive a stroke?
Well, we know the death rate, so the mortality as we call it, 1 in 8 people die of stroke within a month. And 1 in 4 people of stroke will die within a year. So this is the 4th largest cause of death in the UK and in the Western world. So we're not talking about small. This is a significant health issue, and it has significant impact on the health and economy of the nation. At any given point of time, we have about 1.2 million people who have had stroke within the country. So it is and it causes a lot of anxiety, and there is a chance that stroke is recurrent. The chance that stroke can happen again in people who have had is also slightly higher in those people who've had strokes.
And again, I know you're very much involved in education to help people with that. And actually, I was going to ask you, Charles, How much have you changed your lifestyle as a result of having that stroke? What are the things that you're now doing that maybe you weren't doing before to try and prevent another stroke from happening?
First of all, I'm taking my medication as prescribed. And then doing physical exercise as prescribed by my doctor. And also changed my diet. I used to eat a lot of salt many years ago when I was diagnosed hypertensive for many years. And I was told to avoid too much salt, alcohol. So
salt's a big part of this, interesting.
Smoking. I stopped all that immediately. I was addicted to smoking. I smoked too much. But the very day I knew that something is going to get wrong with me, I stopped smoking completely.
There's nothing like something like this to do that for you. And if you had to give one piece of advice to our viewers watching today who either have had a stroke and are recuperating, or people who may be vulnerable to a stroke, we talked about the BME community, how they particularly are vulnerable to it. What would your message be to people today?
My message to people is check your health, check your blood pressure, talk to your doctor if you are confused. If you are giving medication, don't ignore it. Exercise much. If you don't do much exercise, walking from one place to the other is very good exercise. Or you climb the stairs, you know, how many times you do it. It's very good. And change your diet. What you eat, because I was told that what you eat when you are young can be a problem when you grow old.
That's very sound advice, actually, the fact that it all yes, keeps on building up. And finishing off with you, Doctor, and coming back to this campaign, I want to come back, especially as we have Charles here, about the BME group and why they are particularly vulnerable to this. You know, we talked about diet, we talked about salt, and also, you know, specifically in the black community, you know, we hear about sickle cell anemia, and I think there's a link with that as well, isn't there?
Absolutely. Certain conditions, certain blood conditions such as sickle cell is quite prevalent among certain groups and the black population, and that makes you more prone to having strokes. The same goes as with hypertension as well. We know that Caribbean population are more likely to, or twice likely in fact, to have high blood pressure compared to the native. And then South Asian population are twice as likely to have diabetes as it was. And then smoking is more prevalent among the South Asian population than the native. So these risk factors, that is, I think Charles's excellent message is that, you know, watch what you eat, look at your risk factors, make sure that you control it if you do have it, make sure that you take the medication, get things under control, and that is the best thing you can do to stop it happening.
We only have time for one more question, so what I'd like you to do, if it's okay, is first of all repeat what FAST is. Let's really get that message across. Tell us where we can find out more about the campaign and your final word of advice to anybody watching.
So the first thing is the FAST. Act fast. F stands for face. It is a droop of face on one side. A stands for arms. Arms when you hold both arms, outstretched arms in front of you and you're not able to hold it there. S for speech. It's when the speech becomes garbled. T is the time for 999, time to call 999. If any one of these symptoms are present, seek urgent medical attention, call 999. So that is act fast.
So I did right.
Yes, so absolutely. Okay. So the second bit is about, you asked me where to find the information. Yep. You can get a lot of information on Stroke Association website and Public Health England websites. There's a lot to learn about it, and you know, even I look at the websites to find out what is the latest in research and what has been happening in the latest world of stroke. My message to the population is that if you do, please, if you're in a community or if you do recognize that somebody has the symptoms of stroke early, call 999, don't delay, just make sure that you actually call and seek medical attention.
Thank you so much indeed, that was absolutely fantastic. Unfortunately, that is all we've got time for this week. I'd like to thank our guests, first of all, Dr. Andol for coming in, and also to Charles for sharing his amazing story as a survivor as well. We're really grateful to them coming into the show and discussing the importance of acting fast. And if you suspect someone is suffering from a stroke, don't forget you know what to do now. F.A.S.T. Once again, we must stress that should you suffer from any medical problems or health concerns, it's always highly recommended that you contact your doctor or GP, as the Health Show gives you an alternative viewpoint to the health concern being discussed. If you'd like to find out any more information about this or any of the subjects we've discussed on this or any of our shows, please do email us at healthshow@islamchannel.tv. And we'd like to tell you that we're coming to the end of the Health Show for this season, but we will be back, and do make sure you tune in for our last episode of the season next week. But for now, bye for now. Assalamu alaikum.